This video describes about sickle cell anemia. Sickle cell anemia is a hemolytic anemia characterized by abnormally shaped red blood cells which are removed from the circulation and destroyed at increasing rates, leading to anemia. The underlying abnormality in the RBC of the sickle cell anemia is the presence of abnormal sickle cell hemoglobin, that is HbS, which when deoxygenates becomes relatively insoluble and forms aggregates with other hemoglobin molecules within the RBC. These aggregates develop into long chain which distort the RBC into a sickle shape and impair the flow through the vessels. In addition, the deformed RBC tend to adhere to the endothelium, worsening vascular occlusion, ischemia, and the likelihood of tissue infarction. When we see the genetics of sickle cell, the sickle cell is an autosomal recessive disease. Therefore, the child can only get sickle cell if both parents are carriers, not if only one is and the other is normal. They have a 25% chance of getting it if both are carriers. Pauline et al. Determined that a point mutation in the gene coding the beta chain of the hemoglobin molecule resulted in a single amino acid substitution, that is valine for glutamic acid in the beta globin chain, which when present on both chromosomes in a patient resulted in sickle cell hemoglobin or HbS. When a patient possesses two sickle cell hemoglobin genes, HbSS, sickle cell anemia results. In case of the homozygotes produce abnormal beta chain that makes HbS, and this result in the clinical syndrome of sickle cell disease. In case of the heterozygotes, they produce mixture of normal and abnormal beta chain that make normal HbA and HbS and results in clinically asymptomatic sickle triad. This figure shows the normal red blood cells and on down below shows the sickle cell. Now coming to the prevalence, it is estimated that up to 80,000 people in America have sickle cell disease, and out of them, 1 out of 500 African Americans have sickle cell disease. Let us discuss the pathophysiology of sickle cell anemia. First, there occurs deoxygenation due to various precipitating factors such as viral or bacterial infection, high altitude, stress, surgery, blood loss, or dehydration, causing the polymerization of the hemoglobin, which results in the sickling of the red cells and ultimately leads to the endothelial damage or the activation, which hence leads to the RBC and leukocyte adhesion to the endothelium and vasoconstriction results. Finally, there occurs the vascular occlusion, organ ischemia, and organ damage. Sickle cell crisis. Sickle cell crisis is a severe, painful, acute exacerbation of the RBC sickling causing the vascular occlusion. As the blood flow is impaired, the vasospasm occurs, and if there is more hypoxia, further sickling occurs. The sickle cell are then broken down by the spleen, causing anemia, and then the tissue necrosis occurs from hypoxia, causing chronic leg ulcers. The clinical features of sickle cell anemia. The newborns do not manifest as there is very high hemoglobin F. The two major clinical features of sickle cell anemia are chronic hemolysis and acute episodic vaso-occlusive crisis. Universally, anemia and jaundice are present. There are different crisis episodes of sickle cell anemia, which are acute painful crisis, also known as the vaso-occlusive crisis, acute chest syndrome, acute splenic sequestration, aplastic crisis, and stroke. We will discuss each of them in the forthcoming slides. Vaso-occlusive crisis. The vast majority of patients with sickle cell anemia, the vaso-occlusive complications of the disease are much more clinically troublesome Then is the anemia, which is usually well tolerated. There is the plugging of the small vessel in the bone that produces the acute severe pain. In case of the children, hands or feet are affected, known as the dactylitis. In case of the adults, femur, humerus, ribs, and pelvis, as well as the vertebra is affected. In the figure, you can see the hands and feet in children, known as the sickle cell dactylitis. Acute chest syndrome. Acute chest syndrome is the most common complication. There occurs the sickling of the RBC, which blocks the blood vessel in the lung. The pattern is similar to the pneumonia. The clinical features that occurs here is the chest pain, cough, tachypnea, wheezing, and hypoxia. They also can be pulmonary infarctions. Acute splenic sequestration. It usually occurs in the infants and young children around 6 months to 3 years of age. There is a distinct and episodic event which follows the acute febrile illness. There is the large amount of blood which becomes acutely pooled in the spleen, and there occurs a massive enlargement of the spleen and patient has a circulatory collapse. Around 10% patients with sickle cell anemia have stroke, and around 25 to 30% have occult strokes. Aplastic crisis. It occurs suddenly due to cessation of the marrow erythropoiesis, which is related to the parvovirus B19 infection. Here, the reticulocyte count falls and erythroid precursors decrease. There are numerous complications related to the sickle cell anemia, which is listed here in the slide. In case of the investigations, the peripheral smear shows sickle cells, target cells, and poikilocytosis. The hemoglobin solubility test can be done. Here, the hemoglobin is added to the sodium dithionite. When the solution becomes turbid, this indicates the HbS. Also, hemoglobin electrophoresis can be done. In case of the disease state, the HbS may be around 80 to 100%, but in case of the carrier, around 20 to 40%. Management of sickle cell anemia. The hospitalization for crisis should be done to alter the hypoxia and to control the sickling. First, oxygen should be given to treat the hypoxia, and then rest, fluid, electrolyte to maintain the blood viscosity as well as to prevent the renal damage. Additionally, administration of pneumococcal and meningococcal vaccines should be given, and splenectomy if spleen is sequestrated. Folic acid supplementation can also be done. For the management of pain, paracetamol should be initiated. Later, if there is relentless pain, limited opioids can be given. The main treatment methods in case of the sickle cell anemia are blood transfusions, drug treatment, blood and marrow stem cell transplantation, and gene therapy. The indications for blood transfusion are acute chest syndrome, stroke, severe anemia, acute splenic sequestration, exchange transfusion in life-threatening crisis. The drug treatment is given to patients who are specially susceptible to infection. The drug include penicillin, folic acid, and hydroxyurea. In case of the bone marrow transplantation, the affected person's bone marrow is replaced with cells containing genes for the non-sickle cell hemoglobin. The production of healthy red blood cell starts and the sickle-shaped cells are prevented. If the transplantation is performed when the affected person is still young, then success rate can be as high as 90 to 95%. In case of the gene therapy, correcting the defective gene and inserting it into the bone marrow is done. The turning off the defective gene and simultaneously reactivating another gene that turns on production of the fetal hemoglobin is done in this case. Thank you. Please do like, subscribe my channel and share this video.